Hi guys, sorry I wasn't able to attend class. Pardon my voice. So today we're going to talk about early intervention, IDEA Part C. My objectives are to define IDEA Part C, identify the eligibility requirements needed to receive Part C, list the order of rules and regulations for acquiring Part C, establish payment for Part C services, identify the types of services provided for Part C, and describe the role of the physical therapist. First, some background. Part C is a program developed for infant and toddlers with disabilities, and it's a federal grant program which assists states in operating a comprehensive statewide program for early intervention services, ages birth through 2, and their families. It was established in Congress in 1986 as an urgent and substantial need. This program helps to enhance development, reduce education costs, minimize the likelihood of institutionalization, maximize independent living, and enhance the capacity of families to meet their child's needs. Eligibility requirements. Each state is able to determine what their eligibility requirement is, but they have to include the following categories. So the first category is if the child is experiencing development delay as measured by appropriate diagnostic instruments and procedures in one or more of the following areas. It can include cognitive, physical, which is vision and hearing, communication, social or emotional, and adaptive development. Each state also can determine the percentage of delay that will be used for their eligibility criteria. The second category is a diagnosis of physical or mental condition that has a high probability of resulting in development delay. Each state also has the option for adding an additional category, which is an at-risk category, due to biological or environmental factors. These can include low birth weight, respiratory distress as a newborn, lack of oxygen, brain hemorrhage, infection, nutritional deprivation, a history of abuse or neglect, or directly affected by illegal substance abuse or withdrawal symptoms resulting from prenatal drug exposure. Some rules and regulations. So first of all, anyone can refer a child for Part C. This can be a physician, a hospital, a parent, or anyone that spends time with a child and can see a development delay. Then the infant or toddler is to be evaluated to determine eligibility and to meet those two categories. Parental consent is required for this evaluation to take place. Then an additional individual family service plan, or IFSP, meeting is held and written where it will just be decided what services are needed and required for that child. So it's an individualized plan. Then the early intervention services are provided based off of the IFSP plan and are provided in a natural environment. Every 6 months, the IFSP is reviewed and revised if needed, and then reviewed again annually. A transition plan has to be put in place 90 days before the child turns 3, which is included in the written part of the IFSP. The lead agency must then notify the state educational agency and the local education agencies to make sure they take appropriate actions before the child turns 3. Then when they turn 3, they exit early intervention and possibly move to Part B, discussed by someone else. System of payments for Part C. Part C is a statute and regulations, which is they provide a system for payment for Part C services. Each state can they develop their own written policy, which can explain costs, if any, if there are the responsibility of the family. This can be used through public or private insurance or family fees. The types of services included for Part C are listed below. There's quite a few, and mostly they're provided on an individualized family-centered basis, so they may or may not use all of the service listed below. The physical therapy role for Part C is to promote development, learning, and participation in family and community life. To use their own knowledge and skills to relate to motor, self-care function, assistive technology, and medical health care science to contribute to the IFSP team. Collaboration with the team integrating interventions into everyday routines, activities, and locations helps to benefit the child in early intervention so they can live a better and more enjoyable life and have the proper care in place by their families. If you have any questions, please let me know. Thank you for your time.